Hi, I'm Patrick Fallon, the physical therapist at Freedom Health Centers. I'm here to talk to you today about something you may have seen in our clinics if you've been in recently. And that is a technique we call IASTM, which is instrument-assisted soft tissue mobilization. And you usually see us use a tool like this. Now, don't be intimidated by the way it looks. It has many shapes and angles on it to help us do the treatment. So what is IASTM? It is a form of soft tissue mobilization that allows us to get into the fascial and muscle tissue to help break up adhesions. Now, these adhesions are very minute, but they don't allow the fascia system to move over the muscles. We've been having some great success with this tool, especially in situations where they have tendonitis situations. We've been using it with people with scar tissue issues and lack of mobility. So this is an interesting technique. I'm going to demonstrate it really briefly here so you can get an idea about it and we can talk a little bit more about it. This technique has an evidence-based background that is proven to significantly assist inflammation situations. We start out with an emollient that allows the tool to move easily over the tissue. We use a tool which has a rounded edge slightly over the tissue. We start out this technique by doing kind of what we call scanning. What we're doing is feeling for rough edges, adhesions, bumps, and this tool transmits that sensation to my hand just like the end of a fishing pole transmits when a fish nibbles. So it's very easy to feel. After we've done scanning and we find an area that maybe needs some treatment, we can get a little bit more aggressive with different techniques. Working all through the tissues. Now typically these treatments will last about 3 to 5 minutes in any particular area. Commonly in the clinic here you'll see us working on shoulders and elbows, the bottom of the feet for plantar fasciitis, the quadriceps muscle or the calf muscle. We've been getting some great results with it. This is not uncommon in the physical therapy world now, but you need to go to a practitioner that has been trained in it, has been to courses, and has been certified. Now, I have a list of certain conditions here that they've shown through research that this really helps. Shoulder pain, plantar fasciitis, chronic ankle sprains, Achilles tendonitis and shin splints, anterior knee pain, as well as pain runners are getting on the iliotibial band, patellar tendonitis and hamstring strains, post-surgical scarring. We have recently had a patient that has had excellent results after she had a major surgical procedure and had significant scarring. Her mobility is greatly improved and her pain is significantly less. Some of the other things we use it on commonly in the clinic are lateral and medial condylitis, also known as tennis elbow or golfer's elbow, wrist sprains, IT band syndrome, SI and low back pain. Soft tissue changes associated with arthritis also benefit very well. If you were interested in this technique when you come into the clinic, feel free to talk to myself or the physical therapy assistant Renee, who's our nice model here today. We'll be more than happy to answer your questions. If you have a specific condition that you don't know whether or not this may be beneficial for, you can ask us that at the same time.